My guest is here. Each seasonal transition, I invite local herbalist Harry Chrissakis in. Harry Chrissakis is an herbalist, practitioner of natural medicine, and lecturer. He has been in practice for 25 years. The focus of his practice is to assist people who have chronic diseases, cancer, heart disease, diabetes, with the use of natural medicine. He has an active practice in Chico, and his website is herbalist and herbs.com. Welcome.
Thanks, Diane, and thanks, KZFR, for hosting me again.
So generally what I let him do is just go ahead and do his lecture. He's got lots of notes and lots of information, and it's just great.
Yes, I've been doing this lecture for about 10 years, so there's definitely lots of notes.
Great.
So this is diabetes and insulin resistance, which I really consider a major health problem in the Western world, but particularly in the U.S. All the major killers, that is heart disease, cancer, and stroke, and the weight disorders that we have, this pattern that I'm going to lay out is foundational to that, especially heart disease and stroke. And they say indirectly to cancer, although I take issue with that because excess insulin and the stress hormones that are produced under these types of conditions are feed and develop cancer because they break down cell-to-cell communication. It is also, I think, the reason for the weight difficulty that we have in America, which really is a huge number. There's an estimate that there's about 180 million people are overweight in the U.S., and about 60 million of them are obese. That's well over half the country. So it's a big problem, as both of those things, that is being overweight and or being obese, are risk factors for all disorders. So once again, this pattern plays directly into vascular diseases, specifically heart disease and stroke. Heart disease kills about 650,000 people a year, and stroke kills about 300,000. That does not include the amount of people that it maims. That is, there are millions that get these things that still live but are hurt from them for the rest of their life. And we don't want to go there. And although I'm talking about diabetes and entering into heart disease, really it is so deeply tied into it. It is so common to see in my practice that people have either one of these patterns. And the thing is that insulin resistance and type 2 diabetes are on a continuum. If it's assumed that insulin resistance is a more benign situation because it's considered a syndrome and not a full-blown disease, then that is really wrong thinking. There's roughly about 35 million diabetics in the U.S. right now, 30 to 35 million, with roughly another 5 million people that are yet to be diagnosed. But there's about 70 to 80 million people that have insulin resistance. So we only have 330 million people in the U.S., so that's roughly a third of our country that has this pattern that leads to these other major diseases. So, and the thing about both these disorders, that is insulin resistance and type 2 diabetes, is that they are reversible through lifestyle adjustment and diet and exercise. This is definitely true. The model I'm going to present is pretty complete and relatively simple, and so is the treatment methodology, but that doesn't make it easy to do because, it is an addictive element involved in the pattern, and that is an addiction to carbohydrates and sugar, basically, which is one of the main players in the development of the problem. So once again, I just want to state to emphasize, insulin resistance is not a benign condition, and it is extremely common. And it's easy enough to see on blood tests. When people come to me as type 2 diabetics, of course, they're already diagnosed. Now, the factors that go into creating insulin resistance eventually produce diabetes, but really the marker, it's a very simple test that transition says happened. And all the things that are happening in type 2 diabetes are also happening in insulin resistance. They may not be to the same extent, but they're still very dangerous in the long term. And an important thing to remember, too, is because this is a lifestyle problem, it takes a long time to develop, and it's a silent disorder. So it's very good for people to get blood tested post-40. I mean, it is very common to see young diabetics now. I mean, very young, 20, 15 even. due to the problems. But it's also, as in a population of people to say the 40 to 50 to 60-year-old range, it usually starts around 40 when things really start to separate. And that is true of many disorders. Like our body has the capacity to hold out for quite a long time. And again, with this particular pattern, it has the capacity to adapt to it, which is not a great adaptation. Adaptation has application when it meets something, adapts to it, and then comes back to rest. This doesn't rest. This means you're altering neural endocrine function, which are two basic fundamental controlling systems in the body. They are key to health and energy and longevity. And insulin resistance and diabetes messes with both of them in a very big way. Now, once again, I said, this takes a long time to develop. It's a silent problem. It's a lifestyle difficulty. And it's not anything to indict anyone about. It's just what we've been trained or thought was right to do. And actually turns out that it's not very good for you. So let's get into the idea of applying ideas to it, and also showing you how you get the problem, and also explaining to you how our body works with glucose and regulates it. Now, one of the things, let me separate a couple of things out first. The difference between type 1 and type 2 diabetes. A type 1 diabetic is insulin dependent. The part of his pancreas that makes insulin has been damaged either through infection or some type of illness, or he had it genetically. There was some genetic glitch that occurred that damaged that part, that it never produced things correctly, in which case this person is insulin dependent for their life. Now, the thing about what I'm laying out in this program for insulin resistance and type 2 diabetes also applies to type 1 diabetics. I can never get rid of the fact that they have to use injectable insulin. That is absolutely necessary. But I can lower their insulin load, and that is critical to getting things right and not having the insulin destroy them long term. There's a common myth in the general public that insulin is a cure for type 2 diabetes. It is not a cure. It is a treatment methodology which long term has very downsides to it. It's very hard to regulate blood sugars from the outside. Of course, again, in the case of a type 1 diabetic, you have to do that. But again, as least impact on the body, because if you talk to a physiologist and you ask him, what's worse in the bloodstream, excess glucose or excess insulin, he's going to tell you excess insulin long term. And in both of these patterns, insulin resistance and type 2 diabetes, especially the earlier section of it, type 2 diabetes, there is major insulin resistance with elevated glucose and elevated insulin in the bloodstream for extended periods of time, both of which create massive amounts of damage long term. And these type of blood sugar dysregulations in and of themselves produce stress responses, because this becomes a major player in the development of all diseases. Stress response is involved in all disease disorders, and it's not some type of nebulous term where you say, I'm stressed out. I mean, that's okay, but it's actually measurable through blood, saliva, or urine, that you can measure adrenal metabolites and or cortisol. Okay, so these are big things that you can see and know is actually happening with someone. Through blood testing, again, I'm a big fan of technology, both screening, diagnostic, and prognostic. I think it's one of the great strengths of Western medicine, that, surgery, and acute crisis care. I do take issue with the method of approach to type 2 diabetes, which in many situations consists of a diet that has at least 40% carbohydrate, which is a bad idea, in my opinion. The general approach is the use of metformin, which is a relatively innocuous drug, although it will drain folic acid and B12 in the long term, and the use of drugs which are much harder on the body, which are called sulfonylureas, which drive the pancreas to make more insulin. It is a short-term Band-Aid with a long-term downside. If you push the pancreas hard enough from the drug, you will burn it out, which is what happens, and then you become an insulin-dependent type 2 diabetic, a more advanced stage of it. Now you have to inject insulin. You do not want to, nor do you have to go there. That is really a misconception based upon the application of certain ideas in relationship to this problem that really don't hold water in the light of physiology. A lot of the work that I got is from two two people, Gerald Robin, who did the original work on it, who was a clinical abstract researcher, and Paul Bergner, who in my opinion is a genius in terms of being a clinician. So that's kind of the form that I put together here and that I'm going to elucidate to you. Okay, so I hope you understand the difference between type 1 and type 2 diabetes and the difference between insulin resistance and type 2 diabetes. Insulin resistance and type 2 diabetes are on a continuum. Just remember that. That's an important idea. Okay, in terms of the relevance of being a type 2 diabetic, and I really want to emphasize this again, the same stuff is going on in insulin resistance. And that is this: you are 4 times more likely to get a heart attack, 4 times more likely to have a stroke. A man is 5 times more likely to be impotent. You are 5 times more likely to go blind. Remember that type 2 diabetes is one of the primary causes of blindness, amputation, and kidney dialysis dependence. Big stuff. I mean, they will make your life miserable, obviously. So again, and the average diabetic lives about 15 years less than the general population, which is 76 years. That means at 61, you are at risk for dying already. Not a good number. I mean, really, it steals a lot from us and we get very little in terms of return of pleasure for doing the types of things we do. And again, this is a reversible problem. I really want to emphasize that people can do things. When I work with people, they generally do not have to see me very often. If this is the only thing they're seeing me for, you should know what you're doing after 3 or 4 visits. You should know why you're doing it, which is great ammunition to help your willpower. And once again, 95% of type 2 diabetics are overweight. This proves that this pattern chunks on the weight, and you cannot lose it unless you remove the underlying pattern. If you crash diet, you lose muscle mass and fluid, meaning you burn protein. Bad idea. When you go off that kind of diet, you put on fat. So really, you want people to burn fat, have even amounts of energy. Okay, let's go into how the body deals with sugar. There are basically 3 legs to how it works. I'm just going to talk about 2 primarily. It's the liver and the pancreas. The adrenal glands also play a part through stress response. But primarily liver and pancreas. Your moment-to-moment glucose regulation is determined by your liver. It stores sugars in the form of a starch called glycogen. When your blood sugars start to dip, it breaks down the glycogen and feeds it and creates sugar and glucose, and then feeds it back into the bloodstream and brings it back up to normalcy. Because you need a certain amount of glucose in your bloodstream circulating all the time, otherwise you faint. Brain needs lots of glucose, lots. Okay, so there's something called the glycemic index and the glycemic load, both of which are measurements of how quickly and how densely, when you eat something, it pours sugar into your bloodstream directly. Sugar is rated at 100. But flour products, and many of the grains fall into this, but particularly white flour, is rated at around 75. That means that even though we look at white flour products as food, our body looks at them like sugar and works with it that way. Now, when we pump some of this stuff into ourselves, and it could be a piece of cake, and it could be a breakfast cereal of some puff thing or puff grain or something with sugar and milk, we blast a huge amount of glucose into our bloodstream, and the organ that responds to that is the pancreas, and it responds by producing insulin. The insulin is shot through the liver first because it wants to now shut the liver off from converting glycogen to glucose, because now we got too much sugar in our bloodstream. We got to definitely shut that down. This is an important point for later on, because when people become insulin resistant, the liver becomes insulin resistant, and you become a fat factory. So part of the pattern of treating people when they see me is sometimes they come just for being overweight. And I always tell them, look, I'll bring your weight down, but that's not what I'm looking at. I'm looking at your insulin and glucose levels. Okay, so to get back, So now the pancreas has produced the insulin, it's shot it through the liver, it has then been shot through the general circulation. The insulin binds to glucose. You form an insulin-glucose complex. That binds to a receptor on the surface of the cell and then delivers the glucose into the cell along with a number of other very important micronutrients that have to do with how well the cell works, how well it can rebuild itself, and crucial to its own health. So this becomes one of the first problems that begins to occur, is that there are many of these types of spikes with excess glucose, and I'll explain to you how it begins to happen. Now, the third leg that goes into it is the adrenal glands. And the adrenal glands produce stress hormones, but they also produce a hormone that backs up adrenaline and noradrenaline called cortisol, which is a glucocorticoid, which forces things to be converted into sugar for the stress response. So as you can imagine, if you're stressed out and this is happening, this plays a major role in developing the problem. Okay, so when the pancreas has pumped out the insulin, it's bound to the glucose, it's cleared the blood serum of excess glucose, then we go back to the normal relationship between the liver and the pancreas. The liver takes over if it gets too low, again. So that's the general pattern, again, with the adrenal glands playing their part too. Okay, so now let's go into an example of what I call Joe and Josephine America. This is, to talk about what I consider an average lifestyle. A person gets up in the morning, they have a cup of tea or a cup of coffee, they may have a piece of bread with jam on it, or they may have a cup of coffee with a donut or a glass of milk with a donut, or they may have some type of puffed grain with milk and sugar, and they may have a glass of orange juice with that. Come around 10 o'clock, they start to feel a bit shaky and a little blurry in their thinking, so they get another cup of coffee and a cookie or a donut. Around 12 o'clock is lunch, 12:30, it's either a sandwich or a pasta. Maybe they have a cappuccino or a coffee with that. Maybe they have a beer. Maybe they have a soda or an iced tea. Maybe they have dessert. Come around 3 o'clock, they start feeling a little bit shaky again, a little bit blurry. This time they really jam it down. They go into the soda and the sugar, the candy bar exit. And take that down to get boosted up again. And then around 8 o'clock, they have their major meal of the day, which lasts maybe till 9 o'clock, and then they go to bed around 10:30 or 11. This is a recipe for disaster in terms of producing these kind of problems. Again, remember, we're not doing this. Doesn't happen in a year or two. This is decades of this kind of behavior. So these are the types of things we've been trained to do. Carbohydrates are cheap, they taste good, and we eventually become addicted to them to get straight. That's what happens. You start to see addictive eating patterns. Many people who have this pattern do not eat breakfast because their blood sugars in the morning are too damn high. So when they start to crash, they're in the middle of the road, they have reactive eating. They pull over anywhere and grab anything, usually a carbohydrate, to get back straight again, to get the numbers back up again. So again, one of the big deals in working with the pattern is to get people to shift from these heavy meals at night to a more substantial meal in the morning. That's a big deal. But let's go into the things that create it first. The first leg, right, is the excess consumption of carbohydrates. Okay, that's in the form of sugars and or flour products, baked goods, whatever. That's a dependence on them, like I've laid out in this pattern that Joe and Josephine America has. Right. The second leg of the problem is poor quality fats. Now, in the first leg, you start to produce excess glucose. You start to have these hyper and hypo flips, which the body adjusts to for a long time. But once you start sticking in poor quality fats, which are in everything and all over the supermarket shelves, now you create a difficulty in the membrane of the cell because it's a bilipid layer. It's got two layers of fat, and it gets the fat from the diet that you have. So if you have poor quality fats, your cell membrane is made up of poor quality fats. The cell membrane gets hard. It starts to resist things coming in, like insulin and micronutrients that it needs, and waste going out of the cell. It compromises the cell. So poor quality fats, this is the exceptions, and there are two sections to it. There's dietary fats, which consists of olive oil, extra virgin olive oil specifically, coconut oil, and or butter as saturated fats. Saturated fats are good. Those two are very, very good. I'm not a real strong believer in the cholesterol theory, but I do believe that quality of fats is a huge thing. So those are your dietary fats. Your supplementary fats are basically fish oils, borage oil, and if you want, flax seed, ground, fresh. I'm a big stickler on flaxseed. I don't like flaxseed oil. I think it's just too oxidative. It's too unstable. But when you grind flax fresh and put it onto things, then it's really excellent because you get the omega-3s, you get the fiber, and you get the lignans. So that's a big deal. So, okay, so now you see these first two legs are the excess consumption of carbohydrates and sugars and the excess consumption of poor quality fats. The third leg is a lack of trace minerals, critical trace minerals that we just don't get in our diet. The primary one being chromium. It's just not in our food anymore because we don't put it in our soils in terms of fertilizing. And also the absorption rate is very low generally. Even with a supplement, it's only around 3%. So chromium is intrinsic, and its primary function is to form an insulin receptor. It's part of the process. If you don't have enough or any, you don't make the receptor or you poorly form it, in which case, either case, the insulin complex cannot dock onto the cell. This is adding to the insulin resistance. Okay, the zinc and the other two micronutrients are zinc and magnesium, which have to do with the metabolism of sugar inside the cell, again, which we are chronically short on across the board. Zinc and magnesium are estimated parts of 300 enzyme systems. That's not enzymes, that's systems, which means multiple enzymes in each system, which do everything. So it's really important to just take these things supplementarily anyway, but critical in this area particularly. The next leg of the problem is a lack of exercise, specifically resistance exercise. Now, we used to do these kind of things, these type of breakfasts, but then we would go out and have to work physically because that was what life demanded. Now we sit down in front of a computer or our phones or whatever. So we don't engage the gross muscles. And you need, a particular type of exercise, which is resistance exercise. Aerobic exercise will not do it. You can mix it up, but you've got to do resistance at least 4 times a week under this program. And it doesn't have to be a gigantic program. 20 minutes is fine. This is a very difficult area for people because many things they'll do, but exercise is tough. And in many of my lectures, I talk about exercise and I say it's good for everything, but nobody wants to do any of it. But to emphasize again, in this pattern, you have to do resistance exercise, which is putting a load on the muscle. When you put a load on the muscle, the gross muscle, it burns up its sugar stores. Now it has to draw more sugar into it to get the muscle to function properly. It does not need insulin to do so. So you've added a kind of controlling element from something you've induced on your own. You've actually added another organ to control blood sugars better. And if you do the types of exercise, you'll convert, along with this type of diet, you'll convert fat into muscle mass, which is even better. When I have people who come in and lose weight, they lose quite a bit because generally they're quite overweight. And at a certain point, it becomes hard. And what you see is that their waist size goes down, but they don't lose any weight, which means they've gained muscle mass. This is excellent. Even though they may not like it, I like it very much, especially in older clients. I want to see them stronger because the general loss of muscle and bone over the years, post-45, can reach up to 1.5%, and for a woman it can go up way higher during menopause, up to 5%. So doing things that keep muscle mass strong and doing this kind of exercise also has to do with bone remodeling and osteoporosis. So it's a big deal. It's very helpful and simple. Walking uphill is a resistance exercise. So just keep it simple, but make sure you put a load on your muscle. So stationary bicycle with a resistance, weightlifting, any form of isometric push-ups, pressing against the wall, that's all valid stuff. It all works. The last leg of the difficulty is stress response.
We're speaking with Harry Chrissakis, local herbalist, practitioner of natural medicine, and lecturer. We're speaking about diabetes.
Okay, the last leg of the problem is stress response. And once again, I want to stress the idea that this is a quantifiable thing. This is not a subjective idea. So you can look at blood, saliva, or urine, and you can determine that a person's stressed out. Now, what's interesting about this fifth leg is that if you do the first four legs in terms of how we're going to turn this around of the program, the fifth leg starts to come into order on its own, because the pattern of insulin resistance and type 2 diabetes is very stressful to the body. Anytime it's struggling to maintain sugar levels, either way, too high or too low, you're stressing it, right? You're putting extra load and problem into it from the inside out. And it also makes a person's ability to deal with stress, to have a good stress response, extremely compromised. When you have this underlying pattern in you, it tends to make people brittle because they're often tired, because often, not always, but often they also don't sleep well because their stress response hormones have altered their circadian rhythms. Now, this is an interesting point of fact, because what I'm giving you is kind of a general structure and an approach to it. As a clinician, there's lots of individual differences that occur. Like, some people do sleep well and a lot of people don't. And if you don't treat the fact that they don't sleep well, they are not going to recover. Not. It's too big of an influence. The same thing is with things like you can't replace sunlight. You can't replace good food. You just cannot do it. I don't care what science comes up with. So again, this is a critical factor, and the fact that you do things on an individual basis wraps itself around the problem. Another thing is people have upper GI difficulties. And this program, you need supplements. You need to take things. What if they can't digest them? So you have to go in there, you have to fix that kind of a problem, and then you can have much more success with this idea. Often you're working things simultaneously, so it's not like you're working anything exclusively. In terms of stress response, adaptogenic herbs play a major role in working with people. I can't, again, overstate how valuable this particular class of herbs are. In all traditional herbal medicines, Ayurvedic, Chinese, you'll see the top of the class of herbs are tonics, but at the top of the tonics are the adaptogens. There's only about 30 or 35 of them worldwide so far that have been classified, and they've been looking for them for a long time, so there's not a whole lot of them out there. And there's a lot of great ones. I mean, ginseng is, a common one that people know, but there's a lot of great stuff out there that's reasonable in price that will compare with ginseng. So anyway, just gives you an idea that those things are out there, but I use them a lot in my practice across the board because they do such amazing things to the core controlling systems of the body, the neural endocrine system. They balance that out. They balance stress response out. They give more capacity to endure stress. That's why they got the name adaptogens, because they gave the body the ability to adapt to non-specific stressors. That means anything. That means hot, cold, diet, too much thought, emotional struggles, whatever it may be. Now, when I work with people in terms of stress response, some of them have other difficulties that are psychological difficulties that it's beyond my capacity. So I often work with a therapist with them to help them with that, but I'm still using this stuff because I approach from, a cellular point of view. That's my thing. Okay, so those are the 5 legs. And when you're working with people, basically you're walking this thing backwards in a way. But we can start out with the idea of breakfast as I began before, and that is you got to get people to start eating breakfast. Usually it takes about 6 weeks to 8 weeks to get the appetite response back. Okay, it takes quite a while. And this is a slow transition type of medicine, natural medicine. It takes 6 to 8 weeks for your fish oils and stuff like that to be incorporated into the cell walls. However, during this period, people will definitely feel a difference if they follow the general pattern of the idea, that is the general structure or the skeleton that I'm going to lay out for you. Okay, so you want them to eat breakfast. And if they can't eat breakfast, which again can be a difficulty for people, if you have a bunch of kids and you got to go to work, you got to get them fed and you got to get out. So often people just buzz out of the house. And if you look at breakfast and lunch, they tend to be shorter meals because you're under work pressure. So in that case, especially in breakfast, I put together shakes for them to take. It has 4 or 5 ingredients. They can put it together in about 1.5 minutes. It tastes good and it's nutrient dense. Because when they drive around without eating, they have reactive eating responses that are based upon the need for carbohydrates. And it's very hard on the body to keep doing this kind of stuff to yourself. It starts to break down after a while, and you pay dearly for something that really isn't worth very much. So put them on shakes if I can. I prefer that they eat breakfast. And again, the patterns of eating that I'm going to have are things that wrap themselves around the idea of proteins, carbohydrates, and fats. Proteins, fats, and fibers, with the exclusion of carbohydrates. Now, this is not about carbohydrate bashing. I'm not against whole grains and good carbohydrates. I'm not even against desserts or anything. I like that stuff too. But the question is, when you're in trouble, you have to look at what's doing the problem, what's creating the problem. So this is a major leg in the difficulty, is the excess consumption of sugar and carbohydrates. And a lot of people don't think of grains, and under the circumstances, because the pancreas has become hyperreactive, it's producing so much insulin that it just fires too much out each time, that even whole grains are not a great idea if this pattern is deep enough in our bodies. So again, people have to look at all that stuff, and that includes things like rice and potatoes. It even includes certain fruits, grapes, pineapples, watermelon, which again are bananas, which again are great fruits, and don't affect all diabetics. Some people take them and they're fine. Other people take them and they go through the ceiling. So I just use it as a general approach. They can have lots of other kind of fruits, and I really encourage them to do so. Things that have more structure to them, like pears, apples, berries, melons. So it's pretty wide. It's just those excluding a few things in terms of the area of fruits. And once again, I want to say that those fruits and the grains that you may have to exclude are good food. And when people get better, they can go back to those things. I want them to. But under these circumstances, I want them to move towards proteins, fats, and fibers. And the fibers come from fruits and vegetables, primarily. You can do stuff like freshly ground flaxseed if you want. That's a great idea. I mean, I really advocate it as well, because it does so many good things for you. But it's really got to be freshly ground on the food or in the water. You can't buy it pre-done. It's just too fragile of a product. Okay, so breakfast, right? You want to try and get people to eat breakfast, either the meal or the shake. You want them to have snacks, which consist of this general idea, again, of combining proteins, fibers, and fats. So the perfect structure of a snack in my mind is a pear and a piece of cheese, or an apple and a piece of cheese, or either one of those fruits and almonds or walnuts, right? That's got fat in it from the nuts or the cheese. It's got protein from the nuts or the cheese. It's got fiber from the fruits. Plus, you get all the living stuff, the enzymes and whatever, that are in the apple and the pear, which are critical also to our health. So great idea, those kind of snacks, instead of the corn chips and whatever other carbohydrate we're used to doing. Not a great idea. Okay, so now you're trying to bring this thing into focus and bringing back the idea of also bringing in high-quality fats. As I mentioned, they're dietary fats. That's extra virgin olive oil, coconut oil, and or butter. I like to cook with 50-50 virgin oil and coconut oil. It's great flavor. The coconut oil raises the smoke point of the olive oil, which is a bit too low normally. You can use butter too. If you want to use butter to cook with, you should clarify it. Otherwise, you're going to begin to burn the milk solids in it, which is a very simple process. That's what ghee is. That's where it comes from. But anyway, those are your dietary fats. And your supplementary fats are fish oils, GLA, that's either DHA and EPA. And the way you rate a fish oil capsule is not by the overall fish oil, but by those two markers. You check the amount of DHA and EPA in the cap, and that'll give you a number. And compare it to other companies, and you'll see who's doing what for you in terms of quality. The other thing is borage oil, which is an omega-6. Now that's, people say omega-6s are bad. Many of them are. This one is not. This one is buku good. Borage has the highest percentage of it. You can get primrose oil. That's about half the amount in it. It's about 10% for primrose and about 20% for borage oil. So I use borage oil because I want to get that kind of concentration. So those two are your supplementary fats, again, that can go along with either freshly ground flax or freshly pressed flax oil, which is not easy to do. Those are your dietary and supplementary fats. The next thing is the use of supplements of chromium, zinc, and magnesium. Now, when I work with people initially, I hyperload them on all of those things, and then I bring the numbers down because I want to get blood levels up. And also, some of the things are not absorbed well. So you've got to add higher amounts than what's generally the USDA stuff. So I like to go high on chromium and somewhat high on zinc and somewhat high in magnesium. And you got to watch out with magnesium because it can cause bowel intolerance. So again, those things, all of those trace minerals are short in our diet. I mean, it's not very hard to see if you test people. They're just not in the food. They're just they're not even in the supermarket vegetables anymore. So you got to really try to do things with your diet, move more towards organic, more towards natural meats. And if you're going to do natural meats, make sure the company backs it up because that's a term that's a bit nebulous. Organic meats, of course, are mandated. They have to follow a certain order. And same thing with dairy. I mean, it's really a big deal in the long term if you can afford to do it. And some things are not that big a deal in terms of price. Okay, so as I mentioned, the third leg was the trace minerals. The fourth leg is this resistance exercise idea, which is, again, very simple. Walking uphill, push-ups, whatever. And again, 20 minutes a day. And again, if you want to alternate that with aerobic stuff, fine. That's totally fine. And the last thing is stress response. Again, I use things to help people with stress response. I give them ashwagandha before bed, for one thing. And it depends. You got to be careful. You got to look at people. It's just like melatonin. People don't always respond positively to things. So I start them out very low, and then I see how they do. And ashwagandha is great for stress response. You can use it during the day, too, although sometimes it makes people a little bit tired. So, again, I try to watch out what I'm doing when I'm working with them. And, again, to modify stress response, I'm combining adaptogens with the formulas that I'm giving people during the day, too, to both strengthen them, to give them more endurance, and to balance this neuroendocrine system, which, remember, is like your hard frame of controlling function in the body. It's coordinating everything and helping you respond properly. Okay, so this is the basic structure of the plan. As you can see, the whole model from top to bottom is not terribly hard to see, and neither is the resolution to it. But the consequences of not doing it are pretty dire, especially as we get older. And once again, insulin resistance is on a continuum with type 2 diabetes, and they are both reversible, and they are both foundational to all the major killers. And we can take it onto ourselves with some degree of self-discipline and this simple idea and go very far with it to turn ourselves around. I want to thank you for listening, and thank KZFR for hosting me, and I want to thank Diane, too.
Excellent. Thank you. Why don't you give the listeners your contact information?
Okay. You can reach me at herbalistandherbs.com. That's my website. And my email is contact@herbalist-herbs. My phone number is 530-933-8244. And yes, I have an office in Chico. Thanks a lot again.
Oh, when's your next lecture?
Oh, I haven't been doing any lectures at the library because they only do nonprofits now. So I'm looking for another venue. So if anybody out there has an idea, please call it in. I can use a space to lecture. And the lectures are free. And they're like what you just heard. And they cover about 10 to 15 different subjects, including cancer, heart disease, women's disorders, lots and lots of good stuff. Thanks a lot again.
Okay. Thank you. Harry Chrissakis, local herbalist and lecturer.